In this video, we'll talk about the basics of capillary beds. So when we're talking capillary beds, we're looking at these networks of very small vessels which will allow exchange between the blood and the surrounding tissue. And when we talk about a capillary bed, we're looking at a network of about 10 to 100 individual capillaries. And typically they're supplied by a single arteriole or a metarteriole. And of course, at the other end, the blood that passes through the capillary bed is typically drained away by either a venule or the distal end of the metarteriole. Now, not every capillary bed is open all at once. If we did, the total containment size or container size for the blood would be so large, we would certainly risk a drop in overall system pressure. So at any given moment, about 75% of the body's capillaries are shut down, which means we have to have ways to control blood coming in. So most of the control involves constriction of upstream arterioles, and we also see that they utilize precapillary sphincters to control the flow of blood into capillary beds. Now, of course, when the sphincters are relaxed, the capillaries have a lot of blood flow, so they're very well perfused with blood. And when the sphincters contract, they close off the blood flow to the capillary network. And here we can see what they're trying to illustrate with this diagram. That here, of course, we have blood flowing in an arteriole, and here is the metarteriole running through the capillary bed, and we can see that we have little sphincters, these little sphincters right here, and of course when they're open it allows perfusion through the capillary bed and for the blood to be collected at the other end. Of course, as I said, vast majority of the time most of these capillary beds are closed. So when they're closed, of course, what happens is blood cannot enter because the sphincters have clamped down, and the blood flows through this through-fare channel and heads straight into the venous system. So any of the blood passing through here did not do any really significant exchange with the local tissue. So we're going to leave it there. That's a very quick, short snippet about the capillary beds. The next video we'll start to look at veins.